Could Chile and Mexico's nutrition warning labels work in the US?
Zero fat, exceso, like 0 calories.
In 2016, Chile made history when its Ministry of Health announced this.
Todos los alimentos que contengan una alta cantidad de sodio, azúcar, grasas saturadas o calorías deberán llevar una señalética muy clara y nítida que nos informen a todos los ciudadanos para una mejor compra o selección de alimentos.
Under this new law, processed foods high in sugar, sodium, saturated fats, and calories would have to carry this black octagon warning label on the front of the package. This, in addition to the nutrition facts panel, products already carried on the back or side of the product. It was done to help consumers who were too confused by the nutrition facts panel make healthier decisions faster when they were at the grocery store. Why?
Cada vez más nos enfermamos menos de infecciones, de neumonía, de otros problemas y cada vez más de enfermedades como enfermedades del corazón que son debidas a problemas que están relacionados con la alimentación.
In 2019, battling an alarming statistic that 8 in 10 adults were considered overweight or obese, Mexico did the same.
Más del 90% de las personas lo entiende en Chile y ha influenciado en sus compras.
As obesity rates and heart-related deaths see steady rises in the United States, could we one day see Chile and Mexico's nutrition warning labels here in the United States? Why could it turn into a legal battlefield? And what does abortion have to do with all of this?
Americans are not winning their battle against obesity.
The report shows obesity rates are on the rise.
People in more states are larger than ever.
Obesity is associated with heart disease, diabetes, and stroke, and even some cancer.
This is a problem, and there's a lot at stake.
This story is about the hyphen between Latin America and the United States.
So I first started looking into this story last year when I went to Oaxaca, Mexico. I went to an Oxxo, which is a popular convenience store down in Mexico, and I couldn't help but notice a sea of black warning labels in the chip aisle. They looked like this, and they said things like exceso calorías, exceso sodio, and when I saw that label, it certainly made me think twice about buying the product. Spoiler alert, I still bought the bag of chips, but it did make me wonder, how did Mexico end up with these warning labels on a bunch of products? I decided to look into when and why Mexico implemented these, and here's what I learned.
In October of 2019, Mexico decided to update the labels on the front of packages from
El
this.
etiquetado que tenemos actualmente en México es este, que es el etiquetado GDA.
Dice grasa, 68 kilocalorías.
Known as the GDA, or Guías Diarias de Alimentación, it was implemented in 2005 to help consumers know if a product was healthy. It had information like the amount of saturated fats, total sugars, and sodium. But critics of the program said it wasn't working. This exchange between a researcher at a nonprofit and a TV news anchor shows one of the problems critics had with the labels. It was too much information, as well as not enough of the right and useful information.
Dice grasa, 68 kilocalorías por porción, que son 100 gramos casi siempre, ¿no?
Pues las porciones, eso es uno de los detalles, que regularmente, o sea, no hay una, digamos, como norma que te diga que siempre las porciones tienen que ser de un tamaño. Entonces, cada empresa decide el tamaño de porción por el que pone este etiquetado.
The new labels would be modeled after Chile's.
Esto consiste en poner al frente del empaque, de manera muy clara, sellos de color negro en forma de octágono que nos digan o que tengan la leyenda alto en azúcares, alto en grasas saturadas, alto en sodio o alto en calorías.
Chile enacted the labels after years of alarming statistics on their front. In 2010, the South American country had one of the highest obesity rates in the region, with more than 3 in 5 people ages 15 to 64 reporting being overweight or obese.
It was a statistic that was catching up with children too. From 1987 to 2016, the percentage of kindergarteners with obesity jumped from 7% to 24.6%. So, have the labels worked? I'll answer that question in a bit, but first I want to take a moment to tell you something. My name is Fernando Hurtado, and I'm a journalist with more than 8 years of experience, most recently with NBC and Telemundo. I recently left that job to launch this channel, In The Hyphen, to tell deeply researched, visually rich stories about US Latinos. In order for me to keep doing stories like this, I need your support, and the best part is that it can be free for you. All you need to do is subscribe so you don't miss my next video. Okay, now back to the video. Have Chile's labels worked? I reached out to Lindsay Smith-Taylor, a nutrition epidemiologist at the University of North Carolina, Chapel Hill, to answer that question.
All of this has resulted in major declines in purchasing of products with these labels. So in Chile, we saw around 30 to 40% reductions in the purchases of products with high sugar labels, for example. So these types of labels are really effective, and they're on par or more effective with pretty much any type of public health nutrition intervention that we've seen.
The labels have also had a secondary effect in Chile.
So companies don't want to put these labels on, and so to avoid them, what they'll do is they'll cut the amount of sugar or sodium or saturated fat in the product.
The effects were so positive that since then, countries like Peru, Uruguay, Mexico, and Argentina have implemented similar laws.
So, could those labels work here in the United States? To answer that question, we first have to understand how nutrition labels work right now in the US.
So, Lindsay, imagine I'm at the grocery store and I see this box. How would I know if something like this is healthy?
So right now, it's really, really hard to tell if that is healthy. It is covered in, it looks like at least 3 nutrition claims: good source of calcium and iron, no high fructose corn syrup, energy for any time of day. And then in the bottom right, it has something called the facts up front, or guideline daily allowance, which gives you numbers about the nutritional content.
The Facts Upfront system is a voluntary program created in 2011 to show a product's overall nutrition. It's based on percent daily value, which tells consumers what percent of the daily recommended value of, say, sodium a product contains.
Those numbers on the front, when you ask consumers what they think, they'll tell you that they like the numbers and they think they're informative. But what we know from the research is that people don't understand them.
If a consumer wanted to quickly know if this product was healthy, the only information they had was the facts up front on the box, as well as the nutrition claims on the front of the box.
And so even though it's telling you that there's no high fructose corn syrup, it probably has more added sugar for a snack than what you really would want, especially for a product that's commonly given to kids. But what happens is that this type of claim causes a health halo. It makes parents think that the product is healthier than it is.
So now if you looked at the back of the box, you know that one bar has 12 grams of added sugar, which is 24% of the recommended daily value of added sugar, which, if I'm being honest, even knowing that percentage, I'm not sure if that number is good or bad, and I'm not alone.
And I will say it's hard for me as a parent, as a consumer, and even as someone who has a PhD in nutrition, it's hard to look at that in a matter of seconds and know if it's healthy or not.
Smith-Taylor has done a ton of research on nutrition labels. She's excited about what we know about Chile and Mexico's black labels.
We have really clear evidence from many experimental studies across settings in the US and in many other countries that those labels are really effective at helping consumers quickly and easily identify when a product is unhealthy. It kind of cuts through the noise of all of those marketing claims and the numbers to help people know whether it's unhealthy or not.
So I wanted to see how consumers would respond to these labels. So I went to Hollywood Boulevard, a tourist hotspot here in Los Angeles. And to do that, I got these 2 bags of Doritos. This is a Mexican bag of Doritos with those nutrition label warnings. This is an American bag without those nutrition label warnings. Also doesn't have any facts up front on the front of the packaging. I wanted to ask people if they could decide which of these 2 items was healthier. Now, a big caveat here, this is not a scientific experiment, obviously, for a few reasons. One, these bags are different sizes. The other factor is that one is in Spanish, one is in English, so if you don't know Spanish, you might have a harder time. But what I did want to see was where on a package people would look to find out if a product was healthy or not, and if these octagonal shapes gave anyone any pause.
And Mom, tell me why are you looking at the bag?
Well, isn't that where the nutrition facts are?
Correct.
Okay.
I'm looking at the calories, and that one's got 410 calories. How much has that one got?
I'm thinking it's 292, but I don't know. So normally for the flaming hot, it has more
salt and spice.
Spicy.
No,
So this one is more. This one is more like unhealthy.
I want you to tell me which of those two bags is healthier.
I feel like this one.
Why?
Because it just doesn't. I feel like they will add more things on this one to make it like hotter.
This one is unhealthy.
Okay, and what did you base it off of?
Well, it says the grasas, which is the fat, right?
Yeah.
The grease. 23 grams.
And the other one?
This one's 0.
That's the case, because sometimes we buy those, yeah, and then we don't understand. Like this one says like exceeding calories, I think.
Okay.
Yeah. So normally we don't even look at the shape. People just like buy the logo. That's it.
Yeah. Does this shape mean anything?
It means stop. So like, wait.
Do you read it as like caution?
I mean, I wouldn't notice it because it's in Spanish and it's black.
Okay.
But I mean, it kind of gives you like a wait a minute. You know what I mean? If you don't know Spanish, you're not really paying attention. But for someone that knows a little bit of Spanish, and you know, I would see it, and yeah, it does say excessive calories.
As you can see, people were generally confused, and of course, it probably didn't help that the Mexican bag of Doritos was in Spanish. I wanted to go back to Smith-Taley's research. I knew that these black octagonal shapes were effective, but my question to her was, why?
Because they're binary. It's only one quick, simple piece of information.
My next question for her, if they're so effective, why doesn't the US implement them?
Warning labels are a form of mandated, compelled speech, and that can, potentially be a First Amendment concern in the US, which poses additional legal barriers to getting these.
The First Amendment, out of all the issues I could imagine people and critics had with these labels, freedom of speech was nowhere near my bingo card. To understand how the First Amendment plays a role in all of this, I went to a lawyer.
The First Amendment says it protects everyone from the government interfering with our right to speak or being compelled to speak. Hi, I'm Jennifer Pomerantz. I'm an associate professor at the NYU School of Global Public Health.
Pomerantz is a public health lawyer who researches food and public health policy. She says one big reason implementing the black octagons in the US would be a challenge is because the United States protects free speech for companies in ways that other countries don't.
So for front of pack labeling, basically you're requiring the food companies to speak or communicate information on the front of pack. So there's a test that the Supreme Court has developed to decide if it's constitutional to require companies to display information.
In 1985, the Supreme Court ruled that companies can be required to display information by law only when it is factual and uncontroversial information.
The concern about Chile is what you're referring to, which is they're a leader in the world. And they came up with the stoplight sign, which is the Supreme Court might interpret as controversial. And when they require the disclosure of controversial information, the courts have found that violates the First Amendment.
Pomerantz and a group of researchers pored over nutrition labels all over the world to see which could pose First Amendment challenges in the US. The team classified nutrition labels around the world into a few categories. Here are two of them. They classified the facts up front label as nutrient-specific data, which Pomerantz describes as labels that use numbers or percentages to communicate nutrient values. Then there's what Chile's labels fall under, interpretive nutrient-specific summary indicators, labels that use icons and words to evaluate overall food quality. These are the labels that could raise First Amendment concerns, according to Pomerantz.
So it's actually about the shape, not the wording in the disclosure. Colors or shapes, which could potentially be considered controversial.
In the paper, the researchers wrote, quote, mandatory FOP labels elicit complex First Amendment questions because they summarize information disclosed in nutrition labeling or provide specific positive or negative interpretive or evaluative information, end quote.
There's another Supreme Court case that could hold clues as to the prospects of mandatory front-of-package warning labels here in the United States.
In the 2018 Supreme Court case, NIFLA versus Becerra, a pro-life nonprofit sued California over its Reproductive Fact Act. The law mandated that medical pro-life pregnancy centers provide written or digital information to patients that states that California has public programs that provide free or low-cost access to abortions. NIFLA sued, arguing that the state was violating its consciences and First Amendment rights. The Supreme Court ruled in favor of NIFLA, calling abortion anything but an uncontroversial topic.
Abortion is a controversial disclosure. Now, the existence of an abortion is not controversial, right? It's a factual thing that existed. And at the time this case was decided, abortion was legal in the United States federally. So the fact that they were calling abortion controversial seems to be broadening what they might consider controversial, which is maybe why you would think that the octagon shape might be controversial, or a stoplight colors could be controversial.
Pomeranz wrote in a paper, quote, "Prior to this case, appellate courts traditionally explained controversial to mean that the factual basis was controversial, not that there is controversy surrounding the topic. For example, GMO labeling is politically controversial, but whether a product is genetically modified is not," end quote.
So if disclosing that abortions exist is controversial, and in turn, Black octagonal warnings may be too, how did we end up with these warnings on cigarettes?
The courts have repeatedly held that that's factual information because the epidemiology or the science linking cigarettes to cancer is so clear that it's not a controversial statement. And actually, another one that courts have upheld was actually a sodium warning label in New York City on restaurant menus. And the reason that they said it was uncontroversial is because the requirement is to warn if the food product contained an entire day's worth of sodium. And so there's no question that that could be, a health harm. So if it was only warning of a small amount, then I don't know, the courts might not have said that that was factual and uncontroversial.
Still, with all those possible legal challenges, food labels in the United States may still soon see a big change.
On January 14, 2025, just days before the Trump administration was set to take office, the Food and Drug Administration officially proposed a new rule.
The FDA is proposing a new requirement to have some of the nutritional information on packages displayed on the front and not just the back.
They also revealed the design. It wasn't the black octagon. Rather, it was modeled after Ecuador's system, which uses percentages and words like high, medium, and low to indicate the amount of nutrients.
That levels of sugar, saturated fat, and salt be displayed on the front. They say those three nutrients are directly linked to chronic diseases when you eat them in excessive amounts.
Unfortunately, the label that they're proposing is very unlike the labels that we've seen that are effective in these other countries. The US FDA proposal, it's not just about the nutrients that are high in, it also includes medium and low, it includes numbers. It essentially looks like the information that's already on the back of the package, but now it's moved to the front of the package. And what we know is, as I said earlier, consumers don't really understand the numbers. Our own research looking at these types of labels has shown, we actually did an experiment a few months ago in a large US sample of Latino people, and we found that the proposed FDA labels were no more effective than a control label at helping consumers identify what was unhealthy.
For Smith-Taley, these proposed labels also bring up a question of accessibility.
So our work has also focused on looking at people with high and low English proficiency. So if we're making labels that are heavy on text, they're using a lot of numbers, can everybody understand that or not? And so far our research has suggested that labels like what they have in Chile that include a shape, that are very clear, that are limited on text, those tend to be more effective across populations because they're really easy to understand.
The Consumer Brands Association, a trade group that represents the consumer goods industry in the US, was quick to rebuke the FDA proposal. They told NBC News that the FDA was considering, quote, schemes with arbitrary scales and symbols that could cause confusion among consumers. The group also voiced support for the voluntary Facts Up Front system and Smart Labels, a voluntary program where food companies add QR codes with nutrition info to packaging. I reached out to the organization for further comment, but did not hear back.
It's unclear what will happen to these proposed labels under President Donald Trump's administration. When President Donald Trump nominated his pick for FDA commissioner, he said that person would work to, quote, properly evaluate harmful chemicals poisoning our nation's food supply and drugs and biologics being given to our nation's youth, end quote. As promising as the science is around mandatory black octagon warning labels, these labels probably would not be a panacea. Researchers are already seeing how companies are finding loopholes around these warning labels.
So what we've seen in multiple countries is that next to the warning label, they'll put other information. They might put a similar shape, or they might put numbers, or they might put like explicitly contradictory information to try to distract consumers.
Then there's what's been reported in Mexico.
In Mexico, we've seen that they've tried to make it so that all faces of the product look the same, which then you'll go to the food store and you'll see, you know, no warning label, and that's because you're actually looking at the back of the package. They'll use different nutrition claims. We've seen anecdotally an increase in the use of sustainability claims, because in some countries they're not allowed to use health or nutrition claims on products with warning labels. So they're figuring out, okay, well, we can't do that, but we can do this. And so one of our, things that we've been working on as researchers is trying to anticipate this whack-a-mole situation, and how can we bring the evidence to inform regulations that don't allow for these kinds of loopholes.
Smith-Taylor says nutrition labels are only one part of the conversation we need to be having.
I think school foods is really important. When we think about the fact that kids are getting about 1/3 of their daily calories at school, sometimes more if you think about kids who are getting breakfast and lunch at school, the nutritional quality of what they're getting is critical for healthy growth and then also healthy preference development. So are they spending the first 18 years, the formative years of their life, eating ultra-processed foods that are potentially harmful to health, or are they getting access to kind of culturally relevant, tasty, healthy foods?
Smith-Taylor also points to something else Chile did. In 2016, Chile voted to prohibit the use of cartoon characters on any products that also have octagonal warnings, which is why Frosted Flakes in Chile look like this. This is in an effort to curb the use of cartoon characters to attract kids' attention.
In addition to that, Chile said you can't sell foods that have these warning labels in schools. And so it really radically changed the school food environment. You don't see Tony the Tiger, you don't see the Toucan Sam. It's a totally different food environment, and that's also really important, especially when we think about children's health.
So, what do you think? Could these labels work in the United States?
Or do you think it's government overreach?